After we recorded our first case, we needed a strategy as a country to test many people as we could at the time. Did we even have the human resource to do so? And did we even have the technology to execute this?
Most of the samples that come here, we don't know whether they are positive or they are negative, but we still work on them all together. So it's been okay. There's a little scare at a point. Sometimes you have some headaches, some fever and all. You think it's maybe you've contracted, but then later you find out maybe you are stressed or something.
From March, April, May, it peaked. And the number of samples that we received was overwhelming. Sometimes we could receive about 5,000 samples. And going through the usual procedure to process the samples would be very difficult and then time consuming. So we adopted the pooling method, where you can pool about 10 samples to become a single sample, process it. If it is negative, it implies that all 10 samples are negative. And if it turns out to be positive, then we have to do what we call unpooling to test the individual samples to identify the positive ones among the pool.
Some frontline health workers were among the list of persons who tested positive. Doreen Frimpong is one of them.
When I was told, we were called to a place and then they broke the news to us. So when I was told, in fact, I couldn't believe it because I was asymptomatic. There was nothing showing. But anyway, I had to protect my family. So I went home. I went to lock myself indoors because we were advised to isolate. And then the family were asking why I was indoors and I couldn't tell them. I only told my sister who lived with me. And I told her to let the children stay away for the moment.
Despite the many interventions, Ghanaians still had challenges in terms of observing the safety protocols back then.
Initially, having waking up, thinking of putting on nose masks, being conscious of your hand washing and other stuff was quite difficult. But it's been a year on, as she said, and then you have to live with it like how you were living with malaria and trying to prevent yourself from getting it.
Especially with the wearing of the nose mask, sometimes, I feel uneasy. Sometimes I just walk about without the nose mask on. And, I have to be prompted by a fellow to put it on. It's not easy anyway, but hey, as the president said, these two shall pass. So we are waiting for...
The country soldiered on until we started peaking again between November 2020 and January 2021. This was blamed on political activities and events during the Yuletide. This again burdened frontline health workers.
Staffing is a problem here. Imagine a 16-bed ICU. We have only 3 critical care nurses.
Wow, 3.
And the rest are auxiliaries who are helping them. So ideally, there should be a critical care nurse at every shift because people are on ventilators, people are on oxygen, but we don't have that numbers.
Other interventions were still being implemented, but the significant of them all was the receipt of 650,000 doses of COVID-19 vaccines on February 24, 2020. On March 1, the first and second gentlemen, along with their spouses, took jabs. Again, there was other hurdle to deal with to get Ghanaians vaccinated. Influential persons including former Presidents Kufuor and Mahama took their jabs. This was followed by prominent kings, members of the executive, judiciary and legislative arms of government. Influential media personalities have also had a share of the vaccine. This was the beginning of the new campaign to get Ghanaians vaccinated. So far, over 300,000 people have been vaccinated. Government is targeting to vaccinate at least 20 million Ghanaians.
Ladies and gentlemen, we started our vaccination program on the 2nd of March using the AstraZeneca vaccine. As of 7th March, 8 p.m. last night, a total of over 202,252 persons have been vaccinated. This is the one that has been electronically entered, and I'll give you some updates on that. Greater Accra alone has vaccinated about 128,088, but they have about 58,000 people they have vaccinated yet to be entered. Because you have reporting from the electronic platform, That's what it is. So both regions, Ashanti, will have about a third of the numbers to be entered.
Ghana has so far recorded over 86,000 cases. The death toll stands at 656, with 272 new cases recorded. There are over 81,000 recoveries and discharge. What conversations should we be having as a country after COVID-19?
The conversation should be, what are the health security issues? Biosafety, biosecurity. That should become routines in national affairs. How, for example, border control systems, air transport, and passengers coming in and going out. How should the health systems be set up so that it can very quickly, in a flexible manner, early detect and respond?
A year ago and now has not stopped. The 3 T's are there. We will continue to test, we'll treat, we'll trace and treat. And that one is there. We will continue to have to create the necessary infrastructure for cases, case management. We need to ensure that our masks and things are being produced across the country. What we are going to do now is that we are entering a different phase of trying to help the body build its own immunity to fight the disease better.
So we are able to get sustained levels of the vaccines that guarantees the level of immunity and protection. Then I will say that we are going to the edge. That's why we will urge Ghanaians that the vaccines are the answer. Though we are not neglecting the other interventions, but vaccines are the sure way to get us very early to the normal Ghanaian state. So please, despite all the myths, I will say that if we won't go back to the normal, let's go for the vaccine.
COVID killed hundreds of thousands of people in other parts of the world, has had more dire economic consequences. But the president's leadership has been phenomenal and has helped to mitigate what would have otherwise been perhaps a far worse situation than what we have now. Can we learn lessons from it? Of course we can. Can we find ways by which, touch wood, perish the thought, if we are hit by something else in the future, we can better handle the situation? I'm sure by the time we are done with all of this, we will be able to pluck out those lessons. But I think a year down the line, we can all agree that the president has given us tremendous leadership, and what we need to do is to not let our guard down or get complacent, but push this through to the very end, and most importantly, build buffers for the next time we're hit by something like this.
As of 11th March 2021, Ghana's active COVID-19 cases stood at 4,782. It appears the mechanisms government and its partners put in place are yielding the needed results. What are you doing as a citizen to make sure the country wins the battle against COVID-19? Kojo Ajuman reporting for Citi News.